And tonight, growing frustration for Central Texans having trouble finding a doctor.
All new at 6 tonight, KVUE's Isabella Basco giving us a closer look at the shortage of primary care physicians nationwide and right here in Austin. Isabella?
Well, Brian, we started looking into this as we kept noticing web searches and social media posts in Austin trying to find a primary care physician or other specialists in Central Texas. Now, we wanted to find out what's behind the shortage of doctors and how it's impacting potential patients.
It's right here.
Since March, Johanna Jones has been having issues with her shoulder.
So I can lift with this arm, but I can't lift with this arm.
And needed to find a primary care doctor, spending weeks trying to find a physician, accepting new patients, but had no success.
I started calling doctors' offices around town, and even when offices said that they were accepting new patients, they had no availability. So I tried a number of clinics in town. The soonest anyone could see me, and this is probably in April, was mid-July. They told me when I was talking to them that there's a doctor shortage, that there's too many people in Austin and not enough doctors.
A report from the Texas Medical Association says it's a challenge for the state to recruit physicians to keep up with population growth. According to their numbers, there are about 198 doctors for every 100,000 Texans. That number has been improving over the past decade, but still falls well below the nationwide ratio of 252 physicians for every 100,000 Americans.
We're somewhere between 20 and 40% behind the pace for places that are more adequately staffed.
Dr. Rodney Young, a member of the Texas Medical Association Board of Trustees, says it's a complicated issue that involves the profession facing more administrative work and lower pay compared to other specialties.
There is a load of paperwork and prior authorization and approvals that need to happen, and that just takes a toll on the availability of the primary care practice to be able to be there to treat patients. And the more patients you have, the more of that avalanche that comes down on you.
Building a robust primary care system, Young says, is the foundation of a functional healthcare system.
I might have ongoing shoulder problems for the rest of my life just because of the delay.
A system which Texans like Jones desperately need. And Jones does have an appointment scheduled with a nurse practitioner in about a week and a half.